how you tested them, how you observed them, what you found. And if we could start over here with Ellie Christian.
We tested the standard of confidentiality and privacy, and what we did was periodically during the day and at the end of the day, we would check all the surfaces to see whether there were any patient data, private information, visible.
Right.
And also, since we have electronic medical records, we checked to see whether the screens were being closed properly. And this was very helpful because we found out that in order to save time, the providers were leaving the station open and just shrinking it. But then we do have patients or other people who could come in and they could, increase the size, and then it would be clear to anyone walking by. And then because there is a lag time on the screensaver, you could see the information for about 3 minutes, depending upon the computer. So we gave instructions on a separate, actually over 2 days separately for the medical assistants and the providers, and they actually found that there was a lock screen feature that we weren't even, some of us were not aware of, that will enable them to quickly lock the screen, and then they just have to type in one password and they're back into the same place. So it was very helpful, and at the end of the day, we would check all the services, we check all the screens, so we actually improved definitely over the days that we did it, so it was extremely helpful.
It's good that you went back and retested and saw if you got an improvement, so that's great.
Yes.
Great. South Central, could you share with us your standard that you tested?
We tested courtesy.
Okay.
And before we tested, we did a training with staff from several departments, from MA's front office and our CPSP coordinators, which took care of 3 locations. And they loved the training. They were able to role play what patients' issues, problems, they arise. And then we were able to tell them how to deal with different situations and scenarios, and make recommendations. They did take some monitoring afterwards, which was a little difficult because we took over that facility in August. Right now the difficulties are we have EHR and paper. So that's a struggle, although they try to try to practice courtesy. That takes up a lot of their time trying to struggle between those 2 systems. And so it is a struggle still, but they do overall pretty well.
Okay, so the front, you were testing it out on the front desk, I'm assuming, and they use the electronic medical record and the paper chart at the same time.
Yes.
Where is the difficulty in their being courteous? How does it get hard?
The patients feel that they're not treated with a smile, that they're not attentive to the phone calls. When the front office picks up the phone, they're in a rush.
Oh, because they're searching and trying to
collect the data that's not on file, on either file. So that's where we're struggling right now.
Okay. So it seems like the front desk is frustrated.
Correct.
In what they have to do in their daily responsibilities, and it's translating over, and the patients can feel it. So definitely something to be worked on. Have you thought about how you guys are going to get through this phase, this transition? When are you fully transitioning over to?
What we're doing is we are hiring additional staff to help support the front office.
That sounds great.
With hopes that it will improve.
Okay, that's great. Thank you for sharing.
Okay, at LACUSD we actually tested the access.
Okay.
So access to care and evaluating our customer service standards at the same time. Just how does the staff respond when they're receiving phone calls. And we discovered that it's difficult for our patients to get into our clinic, just to find the clinic that they need to get into.
Find it over the phone or find it physically?
Mostly over the phone,
Okay.
physically not. If the patients are established and they know us and they've been there, they find us
Okay.
easily. But it's difficult for patients saying, for example, it's a patient who's being referred from their private provider and saying you need to go here. We did the secret call.
Okay, secret shopper.
Yes, and
What did you find?
the patients get the runaround.
Oh, wow.
The runaround. It took me 40 minutes one time just to get in.
Just an appointment or to get someone to answer the phone?
Well, I got different phone numbers and bounced around quite a bit. By the time I finally did get an appointment, and it wasn't even at my facility, it was one of our comprehensive health centers. So
It seems like you've learned a lot from
yes, and a lot of our patients are told, oh, well, if you are being referred here and they are not sick right now, but they want to see a primary care provider, and the mother is calling about my child, I need to get him to a doctor just for regular care, they are being referred to our ER.
Wow.
Yes. So,
What's your next steps?
So our next steps were, and then once we did get into our clinic, so we did various types of different
Navigation.
case scenarios
Okay.
and navigation. So when we were able to get into our own clinics, what we did discover is that time is limited when they answer the phone. Otherwise, you leave a message, they call you back a day or 2 or 3 or 4 or 5
Do
days
they call?
later.
But do they call you back?
They do call back.
Okay.
But it is
it might
days
be
later.
5 days later.
And
That'd be good.
if you do get someone, they're very courteous, but they tell you that they can't help you at that moment and someone will call you back. So it was pretty difficult. And a couple of things we did implement is working with the staff currently that is there and trying to get them to just help the patients when they do call at that moment. Our challenges are finance and our budget, and we truly do not have enough staff. So part of assisting us with this is trying to, we have an agenda put together, meet with our leadership, executive team, and present all of this, and what we discovered. And we need to address several things that we just really can't fix just at this level. Like the phone number for the medical center and the different trees and stopping, the referrals to the ERs and from other departments.
Okay.
Yes.
You might not have control over it, but
Some of it, right.
But you can bring it to light to
Yes.
your leadership.
So that is one of our objectives here, to bring that forth and also to present and try to make a case to obtain staff.
Okay.
That definitely will help at the front end, which is the key. That's our portal there.
Right.
I mean,
It's your other door.
yeah, if they get a bad impression and they don't get the help that they need, oh, I don't wanna go there.
Right. If I can't get access over the phone, what are they going to do when I get there? Thank you for sharing. Is there anything more you wanted to say about testing your standards?
Actually, we do have the customer service standards, and then we're applying and we're practicing to continue the appearance, attitude, respect, communication, and ownership and accountability. We do have a little paragraph under each of the appearance and attitudes and all that. And it's all here.
Did you test one of those standards?
Yes, we did. We actually tested one of the receptionists, and she said it worked out really well. The patient was really happy with the appearance on that stamp, and then her attitude, she had a smile instead of being upset, or, some days we get up on the wrong side of the bed,
Right.
and we come in with an attitude and all that, but she was really satisfied, the customer, or the patient that we had.
I think sometimes what the front desk staff might maybe need to keep in mind is that, or maybe what we should think about as we're hiring them, you need to be an actress, because sometimes you have to pretend to be happy even if you are not. Because you're the first line of, I don't want to say defense, but for the clinic. Almonte, is there anything you want to add about testing your standards? Did you test them, and what did you find?
Yes, we did. We tested the courtesy. I'll start with courtesy, the smile. When they introduce their names, they have to smile along with it. So how we did it, we tested We put a poster in the clinic area, pediatric clinic area. We put all the names of all the staff who work in that area. Okay? We put the names. We categorize it: providers, nurses, and CNAs, registration clerk. What we do, the whole team, we alternate. We do random rounds. So we schedule ourselves. We went to the clinic area. We do random rounds. So we look at the registration clerk just in time when they were registering patients. We want to make sure if they introduce themselves. Most of the time, in the first hour in the morning, they're pretty good at it. Down in the later in the day, you know, it becomes just routine. Oh, hi. You know, it's very routinary, so it's just routine. So when it goes to the clinic area, what we did, we excuse ourselves if the patient is okay or if the mom is okay. We go inside the exam room and we look at how the doctor-provider treat the patient, how the discharge nurse treat the patient, how the intake nurse treat the patient. So we score by that directly. After that, when all the staff are out, we spend a little bit, few minutes with the patient, and we talk to, not the patient or the mom or the guardian, the grandmother. We talk to them, how do you find your visit today? Was the clerk, registration clerk, smile at you when they introduce their name? It's very, it's a measurable item. So once we find out the answer and they identify, because they will remember, oh yeah, Monica helped me today and she really smiled. So once we identify the staff and once it's positive, we have a smile sticker and we put it in the wall. Wow. Where the staff's name is. Right. So the more stickers they have, that means to say the customer standard is working. And our plan was the more stickers they have, they will have Happy Meal at the end. We did not go that far yet.
Wow, very interesting. So we went all the way back to kindergarten.
Yes. So it's more on to incentivize the staff. You do this, I'll give this to you.
Yes.
So it's like a give and take.
Yes. And I mean, you talk about incentivizing. You're great for the last panelist because you keep taking us to where we're going next. But tomorrow we're actually going to be talking about the reward and recognition, and I think people forget as adults that we need it too, the way kids need, you know, the sticker, and we know what we're working towards. So I thank you for sharing that. Very insightful. We have one more word from a sponsor, El Monte, and then we'll be right back to wrap up.
Okay.